My name is Brandon Blood. I'm from Canton, Ohio. Besides Dr. Singh, is there anybody else from Ohio in here? Nice. Whereabouts? Oh, Dr. Rizzitti. Got it. Awesome. How about this? Show of hands. Anybody not from Ohio? All right. Fantastic. So a little bit about me. I own a clinic called Apex Physical Medicine, and we are an integrated medical clinic. We've recently added a minimally invasive orthopedic surgeon for all those patients that still want to fit into that medical model that you just would send them out anyways. So we have a pretty cool team. How we got to this point goes back about 15 years. So about 15 years ago, I was in chiropractic school. I went to Palmer, Florida. Any Palmer, Florida grads in here? All right. So over on the other coast in Daytona Beach area. And my wife and I are both from Canton, Ohio, and we drove home for Christmas because that's where our families were. And after that car ride, she started having back pain. Besides myself, anybody had back pain? All right. Anybody treated back pain? So, we're pretty good at fixing back pain as chiropractors, and, I'm in school, but we had a good network of chiros in our area, and we're like, we'll stretch you out, we'll adjust you, and you'll be all set. Fast forward 2 years, she's still in pain, and it worsened. And it got to the point where we were living back in Ohio, and I was in the basement. I walked up to the steps to see my wife sobbing on the couch. And, I'm concerned. I'm overly concerned at this point. I'm like, what's going on? And she proceeds to tell me that she just tried to walk to the mailbox to get the mail, and her back was in so much pain. And so I'm sitting there, and I'm feeling hopeless. Like, this is my wife. I'm a chiropractor at this point, and I don't know what to do. Up until this point, she went to neurology. She had a nerve study. Anybody had a nerve study or send patient for a nerve study, right? Epidural injections, aquatic therapy, physical therapy, chiropractic care, only to go to the surgeon, which was the next logical step, to hear, there's nothing we can do for you. Just one of the most frustrating things, patient can hear, and things, we don't want to have to tell a patient that, but I appreciated the honesty. It wasn't someone that wasn't just a cut for the sake of cutting. So then you fall into that black hole of, what do you do? Pain management's not doing anything, chiro's not doing anything. So I took it upon myself, and I started researching, and he's since become a good friend, but I didn't know him at the time. His name was Dr. Wyris, and he was the chair of the chiropractic medicine division at Lutheran Hospital, which was a Cleveland Clinic hospital. Anybody familiar with the Cleveland Clinic besides the Ohio folks, right? So I called him up, cold called him, like, hey, I'm Dr. Blood. I come out of school, I'm like, I'm an evidence-based chiropractor, right? What are you doing at the Cleveland Clinic? How's this different? So he invited me up. So I got up there, and he shared space with Dr. Stearns. He's still a orthopedic surgeon for the Cleveland Indians. So we got to talking, and said, Dr. Tony, this is really cool. And I started sharing about my wife. I said, is there anything that you can think of or that you know of, anything different? Are you guys doing anything different up here? Well, here I didn't realize at the time, but at the time they did manipulation under anesthesia in the operating room. And he's like, and as a matter of fact, he goes, your wife sounds like a good candidate for it, and as a matter of fact, I need someone to help me with it. He goes, you need to go get a diplomate. So I had to go sit a test to become a credentialed pain practitioner. And I got privileges at Lutheran Hospital, Cleveland Clinic Hospital. We scheduled operating room time for my wife. And, of course, the anesthesiologist was involved. They sedated her, and we stretched the crap out of her. We adjusted her, and she started getting better after that protocol. So it was that point I decided at some point in my career, because sometimes medicine by itself isn't good, sometimes chiropractic by itself may not do the trick, but sometimes working together, we can get the desired results that we want for our patients. And so that's why I'm here today. So this morning I woke up at about 3:30. I caught a flight out of Cleveland, Ohio. I landed in Orlando because I booked my flight yesterday. And I come to these things because, one, it's always great learning. Never stop learning. Secondly, the relationships. I happened to have lunch with Dr. Singh, and the first time I met him was in Clearwater a couple years ago when we first started. and just the relationships. I've since become a part of the mastermind that the Carberries hold, and if that's an opportunity you ever get to entertain, absolutely consider it. So that's my backstory. That's why I'm here today. I'm jittery because I'm running on coffee right now. Appreciate you guys listening to my story. I got 2 daughters. I'm from Canton, Ohio, Football Hall of Fame city, and go Browns and Cavs and all that good stuff.